This is Dr. Anderson with North Texas Plastic Surgery, and we're going to do a fun one now because I have props. We're going to talk about how to choose an implant profile, size, kind of all of that together. So I talk about breast implants all the time, which is kind of fun. But what happens is people come in and they read all this stuff and there's so much different verbiage, there's so many different things you see that it just starts to get overwhelming and you kind of don't know which way is up. So hopefully we'll go through at least my interpretation of these things throughout this video to help give you a better idea of potentially the right questions to ask and how to get to the right implant for you. We're gonna kind of start off by talking about profile. What does profile actually mean? So depending on whichever brand of implant you're looking at, you're gonna see that they have multiple profiles, and from brand to brand, those profiles are named differently. So what I have with me here are Allergan Naturel. So for the sake of this video, we're gonna kind of focus on that, although I'm sure I'll pepper in a couple other names to hopefully not confuse you, but give you a little clarity there. So we're gonna start profile specifically, and we have to be really specific when we're talking about breast implants. Profile is how tall the implant itself is. So on this stack, we have low, moderate, and full. To confuse you further, there are more profiles than that, but these are common and it's what I have next to me, so that's what we're gonna go with. So as we're increasing in profile, the thickness of the implant itself is gonna go up. So if we have our, let me just confirm, our low profile implant versus our high profile implant, we'll see high profile projects more forward and is rounder. Now I'm already using terminology which might start to get confusing, but I'll clarify it throughout. If we're looking at other brands, you'll see moderate, moderate plus, high profile, and that's just going to be like a Sientra implant versus an Allergan implant. So people come in and they frequently say they want high profile. Technically, if we're high profile, we're talking about Sientra versus Allergan here is full profile. That's essentially high and full are the same. So we got to be really careful. But again, I will help you through that. The way we're looking at these implants right now is they are kind of flat on the surface, which would correlate to like laying down in bed. We tend to think more about implants when we're sitting or standing upright. As we go from flatter to rounder, that on our side view is going to go more projection forward. So again, a lot of people come in and they say they want higher full implants, thinking that means it's going to be more round at the top. When in actuality, what it means, the implant is going to project forward more on the chest when you're upright. I personally am very big on you, the patient, having the majority of the input on which implant to get. Historically, like if you read an old textbook from the 90s, you'd go see the surgeon, they would take your measurement and say, here, you can have this implant. I know that we have so many options and varieties, and you know, Susie who comes in from Karen that comes in, they want different looks, so they should be able to get what they want. I shouldn't be some dictator on high that tells you what to get. You should tell me what you're looking for, and I can help guide you there. So when somebody comes and says, what profile should I get? That's maybe not the most ideal question. The question becomes, what look are you going for? And then we can kind of tailor everything to you. So one of the things that patients love to find on the internet, and they'll come to me asking, they'll say, what's my BWD? And they have no idea what it means, but they know they're supposed to ask about it, which is good. So that is your base width diameter. And the simplest terms, how wide is my breast? Now, that's the simplest way to describe it. The problem is that is a subjective measurement. If you go to multiple consults, you'll get several, they're going to be relatively close, but you're going to get several different numbers there. So I don't think we have to be super rigid in picking the implant that's the exact number. Because, even if I measure you 10 times, I might get 2 or 3 different numbers myself. So we need to pick something that is close to that and going to help you get there. So if somebody comes in and they say, I want a very modest increase, or somebody comes in and they say, yeah, I want to look pretty fake and augmented, that's going to help determine which direction to go. Another question I get asked is size versus profile, which is more important? To me, we're kind of comparing apples to oranges here. So we're asking 2 different questions, so we need 2 different answers then to get to our one answer that fits all of those things. So one of the ways that we're going to help with this is when you come in for your consultation, you're going to start with chatting with my nurse, which is just a little bit easier because she's, a little more disarming and sweet than I am, and will help guide you. So what we'll do is we'll put you in a sports bra, and then we have sizing implants to try. So if you come in and you say, I'm a little deflated after pregnancy and I just want to be back to where I was before, and that was a full C, and now I'm like a deflated B, she'll pick a sizer that kind of is guiding us to where we want to go, and then you'll slip that in the sports bra and you can see in the mirror, okay, that's kind of looking like I want, or it's too big, it's too small. And y'all can play around from there with the different sizers to get to the look that you're hoping to achieve. And then we can see what number is on that sizer to help guide us further. From that point, we'll make 3D imaging to kind of confirm outside of the bra that size, let's say you pick 415, that then when we do a 415 on the 3D imaging, that's also looking close to where you want to be. So that being said, if you come in and you're 4'10" and you weigh 89 pounds and your frame is like this and your base width is like this and you want 400 cc's, we need an implant that is going to be relatively within the confines of that base width, so it's going to project more forward, versus if you're 5'10" and you have a broader rib cage, you're going to need an implant that's wider to get to that 415. Therefore, it's not going to project as much. A question I get asked a little bit less frequently these days is about a round implant versus a teardrop implant. A teardrop implant is, when it's laying down flat, isn't round, it's shaped more like a tear. And the kind of historical textbook thought there is, in a very, very thin patient who wants a as natural look as possible, if you put in an implant that is narrower at the top and more projecting at the bottom, that can potentially give a more natural look long term. Now, there are some inherent issues with those implants that make me not favor them, that I don't think is really worth going into in this video. In my summation, we can still get a really natural look for you with a round implant going under the muscle that is chosen for your size, shape, and desires. So honestly, I don't even really do those teardrop shape implants because we can get the look you're going for with the smooth round implants. All right, let's spend a little bit of time talking about the other aspect of implants that patients often find confusing, and that is cohesivity of the implant. So pretty much every implant that you're gonna see these days, if it's silicone, is what's called a gummy bear implant. What that means is if you cut that implant straight down the middle, the gel inside doesn't ooze out. It's what's called form stable. It just holds its shape. That being said, with our Allergan Natrel implants, there are 3 different thicknesses or firmnesses of the gel that's on the inside of that implant. What does that mean though? So if we go with our softest implant, when I hold it up, you can see from the side that the gel pools at the bottom a little bit. So this is going to give a slightly more natural look than if I do our firmest gel when I hold from the side. Don't worry, I'm going to hold them up at the same time. This holds its shape a little more at the top. So if we want a little more roundness at the top of the breast, this implant's going to help provide for that. So then if we look side by side, we can see a little more natural Little more augmented looking. So we talked about all that stuff. It was a lot. It's probably confusing, whatever. We'll go through it again. That being said, patients still want to know kind of like cool information, bro, but what do people actually get? So if you are coming to me, the vast majority of patients who do come to me have a similar kind of thought that, yeah, it's not going to be totally natural because there's a breast implant, it's going to be augmented, whatever, but they don't want to look super fake. They want in the realm of natural, but pretty and perky and nice. So the most common of all of this stuff that we're talking about is a full profile implant. This is full profile. So we see it has really nice roundness. It's going to give really nice roundness to the breast shape versus like low, which honestly is probably not even worth it. It's too flat. And then so that's profile. We have cohesivity. So these are all the same size here, but each one is a different firmness. The majority, 70 to 80% of people pick the soft touch implant, which again, I'm getting a little too nuanced, but the middle one, because it'll give some nice roundness at the top, but isn't that super firm one that can get a little augmented looking for folks. If you'd like to see more content like this, leave a comment below. Also, don't forget to like and subscribe.